My name is Dr. David Sosnowick. I wanted to just add our humble voice and opinion into the mix of everything going on with the COVID situation now. Now, I understand, of course, there are many experts in various fields who are opining upon the topic all the time, but it's very difficult to be an expert in a disease that no one has any experience with. We do have some limited experience. Our perspective, I just wanted to add, is just from that of a community practice. Obviously, I know many doctors have been in hospital-based practices and they've seen a different picture from what we've seen, but our perspective has been from the community practice here in New York. One thing we must understand, every prediction that was made about this disease has been wrong so far. The treatment recommendations have been constantly changing as well. So it's very difficult to be an expert in this situation, and I think realistically we would need a year from now to analyze carefully everything that went on, all the data from around the world, different experiences, before we can make any serious conclusions about what the exact statistics are with this disease and the best treatments too as well. In New York, of course, here we had it first and we had it worst. We were open throughout the entire crisis and we saw many cases of it. But again, from our community perspective, we saw not the worst cases like in the hospital, but we saw the many people, the iceberg below the surface of all the mild cases. Many people coming in with mild symptoms, many people who simply called on the phone and we told them, your symptoms are mild, stay home, you'll come in later, we'll test something with an antibody later. And I can tell you from that, we definitely saw many cases of this, and thank God, only a handful of our patients sick enough to be hospitalized, and none of them actually serious enough to die, and all discharged and doing much better now, thank God, from that perspective from it. So, what can we say from this? The current status here in New York is clearly a much less number of cases. We've, in the last 2 months, not seen any of the community-based cases that we've been seeing. And even in the United States of America, it's shifted clearly to other areas that it's spreading now. And fortunately, the mortality rate seems to be much lower than what was present here in New York. Obviously, either the treatments are better, or perhaps the elderly, vulnerable patients are being sheltered more and prevented from it, or there's some other dynamic at work. Perhaps even here in New York, there were many more people who were infected that we know about that would skew our statistics completely with this. The treatments clearly also have changed over time, and we would have to wait again a long period of time to see indeed which types of treatments are the best ones, which ones might prevent complications, and what to use in the serious patients who are in the hospital as well. The thing we do know, of course, is that children are the least likely to get this infection. Young adults are unlikely to get serious complications from the infection. And the most vulnerable population is indeed the elderly. Though I can say, even from our experience, we treated elderly patients. My oldest one was 97, who came in with mild symptoms, was diagnosed positive, and went home and recovered uneventfully within a relatively short period of time. So again, we're talking of just the statistics of overall, and our perspective is that of the community perspective, which we've seen, again, large numbers of patients with relatively mild symptoms, and fortunately who recovered fully without any long-term problems from it. So what do we have to look for going forward right now? Since here in New York, we're not having active cases right now, everyone is practicing those things to prevent spread of infection. These are very good things that we're doing right now. The question is, which are the best? Of course, the number one method that we've always recommended is washing hands. Washing hands is the best way to mitigate the spread of any kind of infection. It's why we doctors wash our hands all the time. And it's why we recommend when you come home from somewhere you wash your hands, or you have a hand sanitizer to clean. Clearly, the accidental inoculating of your eyes or nose or mouth with something that you've touched is a major way of transmitting any kind of infection. And I think if people just come away with the realization that washing your hands, especially not touching your face before you've done that, etc., is the best way for you to prevent yourself from getting any type of infection, this will be a good thing for all of us. Masks, of course, masks is another big question. In medicine, of course, the real proven benefit of a mask is to prevent a sick person from spreading infection. And it's of course the same reason why we doctors or in the operating room somewhere wear a mask, to prevent us accidentally sneezing or coughing on a patient and spreading some kind of infection into the patient. The real question, which we don't know and again won't know for a while, is will a healthy person wearing a mask prevent them from getting an infection? And obviously it makes a difference what kind of mask, and it makes a difference how they're wearing it. And people have cloths, and people have it below their nose, and people have many different things. All of these things are obviously questionable, and it will take quite some time to understand whether or not this was really making a significant difference. But washing the hands, definitely. Wearing a mask if you're sick, definitely. And social distancing. And social distancing means, quite frankly, that obviously the spread of infection generally is when you're close with someone. Most of the infections we saw were people who were obviously living with somebody who was infected or working directly next to someone who was infected. And that social distance, according to the CDC, is within 6 feet. According to the World Health Organization, it's 3 feet, which many other countries go by. But it's a cumulative amount of time spent in there. The CDC considers that to be 15 minutes of cumulative close time to be considered an exposure, not just passing somebody in the street. We're talking about standing next to them, talking to them, working with them, living with them. That's a close. That's when obviously a mask may be at best, when you cannot socially distance and you need to protect from accidentally spreading infection to someone else. But again, we're not going to know. We're all taking precautions right now. Certainly when you are close with people, wearing a mask may inhibit infection. But the number one thing, of course, would be if you're sick, don't expose other people to the illness. Do not go near other people. Wear a mask if you cannot completely avoid passing other people as well. And that is the best way for us not to transmit infection. Now we're coming up, once again, this coming winter, we will certainly have another flu season, cold season, and there'll be many people with sneezing, coughing, runny nose. It doesn't mean that everybody doing that has COVID. It doesn't mean that everybody coughing or sneezing is trying to kill you. We're going to have to find out what happens next year in terms of this, but clearly, washing the hands, stay home if you're sick, avoid exposing people, wear a mask if you can't prevent yourself from being near people that you might cough or sneeze on them as well. These are going to be precautions I think all of us will have learned that are the best thing for us to do under these circumstances. So I just wanted to add our voice to this from the community perspective and hope that, God willing, if we see better treatments, less mortality with the disease, and eventual hopeful herd immunity, vaccination available, that we'll overcome this as we do everything else. We still will have to wash our hands, take the flu shots, be careful when we're exposing other people. But hopefully, I think the answers will come with this over time. And I'm looking forward to being able to provide the best medical advice at that time that we'll have. Thank you.
Hi, I'm Dr. Memon from Austin Medical Associates. I wanted to talk to you about COVID and its implications on the future. As New Yorkers, as community members, we're getting ready to move on to phase 4 today, and a lot of you are anxious and have inherent fears and doubts about returning to work. So I'm here to sort of squash some of the myths and help you get ready to get back to work and get back to normalcy. So the first thing, I know a lot of people watch the news and they get scared because of what's going on, but the reality is that New York is at its lowest numbers, lowest hospitalizations, and lowest deaths since the pandemic began in March. And so moving forward, we should think about what we're going to do and how we're going to move forward as a community. And to do so, we should remember that, yeah, there's a pandemic, but also we need to move on with our lives. And in order to do so, of course, we have to take the lessons that we learned from the pandemic as we do so. The first thing, of course, life doesn't stop. We have to get back to work, and a lot of places require you to get tested, and there's a lot of places where you can get tested for the PCR as well as the antibody testing. I know we have that here at Austin Medical Associates. Of course, you want to make sure that you don't have an active infection right now before you go back to work. The next thing, of course, you want to be smart. You want to wear a mask. You want to make sure that if you have the infection, you're quarantining for 14 days. That hasn't changed. But you want to make sure you're not exposing other people to the virus if you experience symptoms such as fevers, chills, myalgias, diarrhea, or any other symptoms that are concerning that are out of the ordinary. The next thing is you want to continue to socially distance, maintain 6 feet apart, and if there is somebody without a mask, you want to make sure that you remind them, of course, that they should also comply with the rules of the state. If 2 people don't wear a mask, the risk of transmission increases by more than 20%. If 1 person, it's more than 5%, and if both people are wearing a mask, it goes down to less than 1%. So both of individuals want to make sure that they wear a mask and keep the 6 feet apart rule. Of course, people are going to go back to school. They're also going to be required to get tested. If you're traveling, if you want to make sure you're not spreading active infection, you want to get tested before you travel. Those are just basic things that we should keep in mind as we move forward. And of course, there's always going to be concerns, and there's people out there, the medical community is here to sort of keep you comfortable and make sure that everyone is on the same page as they move on with their lives, and how we sort of reconstruct New Yorkers and the community for the phases after COVID. Thank you.
Hi, my name is Bishoy. I'm a school director at Austin Medical Assistant Training. Today I'm going to give some advice and recommendation for people who are losing their job, staying home, and stress themselves how they're going to see their future, especially when they have the kids. During this pandemic, we'll always advise and suggest people. Career is very important for everyone to protect yourself and protecting your family. That career can be any type of schools. Our school is specialist in the medical field, so today I'm going to talk to the people who love to work in the medical field, who want to help people, and how can be this career can helping you and protect your life and your future. We always say that we are here in the medical field, care about other people's life. We're giving people hope. We treat people, we make them to feel better. If you are doing that from your heart, helping people, one day you will get this help also. And we can see even during this pandemic, because we are working from our heart, helping people in the medical field, even when the pandemic happened, we still in our job. No one working in the medical field lost their job. They're still working, they're still doing good, care about other people, and also they're getting the help, not losing their job. Our school is a specialist in program related to the medical field, and I always advise that to everyone. Career and education is very important. Every money you put for your education, this is like you invest for your life and your future. And this is the big thing to do at this time. We always advise people who want to go back to the medical field, make sure you go into the right school. Make sure you get in the right education. Make sure you get an experience from the school. That type of the career, it is very hard to get experience when you start to work. Because I can tell you, 99% of the job, they're looking to hire people who has experience. And a lot of people finish school and come, how are we going to have experience and we don't work yet? And I can tell you, Experience, especially in this field, you get it from the school. If you go to the school and you feel you're not getting the right experience or not getting the right education, you don't have to apply in this school from the beginning. In our school, as you can see, we do have a different program and I can recommend it for everyone. This is one of the best programs right now. A lot of people looking to hire. And if you like the medical field, I will advise you to apply one of these programs. But make sure before you apply in any of this program, just make sure you go to the right school. Make sure it doesn't have to be our school. Any school you feel is giving you the right education. Because at this time, we're not doing any advertiser from some specific school. At this time, we care about you. We care about people. Things happen. We have to stand together. We have to give you the right education. Look at school review. Don't believe anyone who works in the school. Most of all people work in school, they try to make their school at the best school. But the best thing to do is check Google review. Check what previous student talking about the school. Check the job placement rate in the school. How many students you will have it on the classroom. Just make sure you're getting the right education. You're paying money. You need to get the quality of education. Don't go to school and you're paying all this money just to walk out by your certificate. Anyone can get the certificate, but medical field, not only certificate. If you're not having your experience, if you don't know what you are doing, it will be very hard to get a job. My advice to everyone, think about it, the career, especially at this crisis in this time, and a lot of people losing the job. Don't stress yourself too much. Don't sit at home and think what you're going to do, how you're going to take care of your family and your kids. Just get yourself back together, go back out, work back to the school to protect yourself. All of us do that. Everyone since has come to this country, especially I'm talking to the immigrant people who are a lot of people in New York is coming from a different country, working hard 12 hours, 13 hours to protect their family, and they doesn't have enough time to go back to the school. But I'm coming from another country and I get to the school. I was working 10 hours, 12 hours, and I have to go work in the school. I was sleeping probably 2 hours a day until I am today in front of you as a school director. A lot of people still doesn't do anything because they think that way. Working hard, tired, doesn't have anything to do. I can tell you that. You can stress yourself, work hard, 2-3 years, finish career, finish school, and you'll get successful and you can have better life and better future. Think about your career, come to the school. We are here at Austin Medical. We can give you advice and you don't have to get back in our program, but you can come to us, sit with one of our advisory to see if this is the right career for you or not. Stay healthy and safe. Thank you.